मौन मौन व्रत धार लिए
बीच में जोक वोक मार लेंगे।
Good afternoon, everyone. Good afternoon, everyone. On the occasion of World Cancer Day, we Onco.com have come live. We will be speaking to our expert panel of oncologists who will be talking on the cancer prevention and early detection of the cancer. So we have three oncologists with us. So first of all, I would like to introduce you to Dr. Shikhar, who is a consultant medical oncologist at Onco Cancer Center, Hyderabad. We have Dr. Sunil Kaushik with us, who is a consultant surgical oncologist at Onco Cancer Center, Hyderabad. We have Dr. M.A. Subur with us, who is a consultant medical oncologist at Onco Cancer Centers, Hyderabad. Thank you so much, Doctor, for joining in today.
Thank you, Nisha.
Thank you.
So, before moving ahead, I just want to tell you about Onco.com and what Onco Cancer Center is exactly. So Onco is your comprehensive care partner, which help you throughout your cancer journey. We offer a lot of services to the cancer patients. We offer cancer care at Onco centers. You'll get the consultation from best oncologists. You'll get second opinion service. You'll get consultation on cancer diet plan. You can directly speak to the doctors. You'll get medicines delivered at your doorsteps. You can you can book a diagnostic test at affordable prices. We have a service like Ask a Question, where you can reach out to your medical team and your doctor and ask any kind of query which you have during the cancer treatment. You can also get affordable treatment packages, which you will get in discounted price on hospital rates. If you find demotivate or low during the cancer treatment throughout the whole journey, we can connect you with the cancer survivor, other cancer survivors who will help you to inspire and motivate throughout this journey. So if you want to reach out to Onco.com, you can call us on 79965 79965. And we have Onco Cancer Center at Hyderabad. You can get a lot of service there, like scalp cooling. You can get affordable treatment cost, personalized cancer care, nutrition guidance, and dedicated care manager throughout your cancer journey. If you want to reach out to the Onco Cancer Center, you can give us a call on 800-8575-405. So on the occasion of World Cancer Day, I would like to introduce our three main offer that we have released for this whole February month. To close the care gap, we bring you on one step closer to the cancer treatment, that you just only need to download our app. So you can avail these three offers, where you can get free diet plan for the whole February month. You can book a consultation at rupees 499. And you can get free cancer care plus subscription at Onco Cancer Center. So again, I would like to thank you all three doctors to joining in. So first of all, I would like to start with you, Dr. Sunil. We can start with what is cancer basically and how it caused.
So we all know that human body is made up of trillions of cells. So our daily body functions are tightly regulated. So similarly, cells divide on a daily basis, and this division is also tightly regulated. But because of certain changes in the genes of a given cell, when this tight regulation is dysregulated and the cell division goes uncontrolled, then this becomes a tumor mass, and that is what is called as cancer. And that's it.
Thank you, Dr. Sunil. Dr. Subur, how does it spread actually, cancer in the body, one organ to other organ? How does it spread basically?
So cancer can spread through many ways, and the mode of cancer spread also depends on what type of cancer it is. So usually the first type of cancer spread is the local spread, with which the cancer mass percolates into the surrounding normal structures and invade normal organs locally. And then we have another mode of spread called as the regional spread to the lymph nodes. So now lymph nodes are a part of the lymphatic system, which are involved in fluid and electrolyte exchange in the normal cells. So once these lymph nodes get involved, it is called as lymph node metastasis. And then the other mode of spread of cancer is by the bloodstream, with which the cancer can spread to distant organs, which is far away from the site of origin of the cancer. So basically, there are three modalities of spread of cancer: local spread, regional spread to the lymph nodes, which is called as lymph node spread, and then bloodborne spread, which is called hematogenous spread.
Dr. Shikhar, there must be some risk factor if you talk about cancer. Can you please explain about some risk factor of cancer?
See, the biggest risk factor that we have today for all types of cancers is the use of tobacco and tobacco products. Cigarette smoking and BD single-handedly, it is estimated to kill 1 billion people in this century. So you can imagine the magnitude of the cancer burden being caused by this one single cancer-causing chemical. Apart from this, alcohol is also a known carcinogen, but still people, they are not aware of its carcinogenic potential. They think it causes only addiction, but it is known to cause several varieties of cancer like liver cancer, etc. Apart from cigarette smoking and alcohol, not being in the right weight range, obesity is a risk factor. And there are other risk factors, but it all depends on the type of cancer that we are discussing. So for a general question like this, I would say cigarette smoking, different tobacco products, and alcohol.
Thank you so much, Dr. Shikhar. Dr. Sunil, people usually consider cancer as a life-threatening. So is it true? Why people always afraid of cancer? What kind of disease it is exactly?
Yeah, the two main important features of cancer is that it is an aggressive disease locally, and as well as it has a tendency to spread to a distant organ which is far away from the site of origin. These two features are define the cancer. So because the cancer can cause effects on an organ which is situated at a distant site, and as well as cause local destruction, it is potentially a life-threatening disease. And a part of it is true, but however, it depends upon the stage at which it is diagnosed. When we diagnose it early, we have currently treatment modalities which can effectively cure the disease in over 80% of the patients. It depends upon the stage at which it is diagnosed.
Dr. Subor, can cancer spread one person to another? Just if we talk about HIV and other disease, people have a taboo about this.
Yeah, this is a very common myth that my patients also inquire about. And let me be very clear about this. So cancer, unlike infectious disease like HIV or TB that you have mentioned, it is not a contagious disease. So it does not spread from one person to the other. This is a very common myth which has to be busted by creating awareness. So a cancer survivor, be it or a patient who is on treatment, they can mingle with their relatives and family members normally without the fear of spreading this cancer from one person to the another.
Thank you, Dr. Subor. Dr. Shikhar, I want to know about some basic symptoms of cancer where people can be more actively look after.
So if you look at the most common cancers in India, in women, the number one cancer is breast cancer. So we all know that breast cancer can present as a painless lump, which is gradually increases in size. A woman might notice this while taking her bath or just during routine self-examination of her breast. Apart from a painless mass, if there are other symptoms like any bleeding from the nipple, or the nipple goes inward, or there are any skin changes, like there are any skin dimplings on top of the breast, all this indicate that this mass might probably be cancerous. Apart from that, if you look at the second most common cancer in women, that is cervical cancer. Any lady who has already achieved menopause but then starts having any bleeding through her vagina, or there is any post-intercourse pain or bleeding, these things can indicate cervical cancer. In men, we all know in India, a lot of them use tobacco products, and that is why they have oral cancers. So any ulcer which does not heal in someone who usually regularly uses tobacco products should indicate that there is something wrong about this ulcer, and he should have it checked. Any person who has a persistent cough which does not go away with simple over-the-counter medications should suspect that he might be at risk for developing lung cancer and should immediately consult their doctor. Apart from this, any unexplained weight loss, a significant weight loss of more than 10% of the person's body weight. So if a person is around 70 kilos, for example, sudden loss of 6 to 7 kilos in the last few months or loss of appetite, all these should also trigger the suspicion of cancer.
I'll come back to you, Dr. Subur. How we can prevent cancer? Is there any general measures that we can reduce our risk? What are the ways to prevent it?
Okay, so again, this question is very frequently asked. Yes, cancer is a preventable disease. As Dr. Shikhar had mentioned, some of the risk factors for cancer. If we avoid these risk factors, we can easily prevent cancer. Especially the foremost common cause of cancer in our country is tobacco consumption. So avoiding tobacco consumption in any form, be it cigarette, BDs or hookah, like which are the smokeless forms of tobacco, and avoiding alcohol consumption can significantly reduce one's risk of cancer, especially head and neck cancers and lung cancer and liver cancer that are caused by tobacco and alcohol. Apart from this, maintaining a healthy lifestyle, such as keeping the weight in check, regularly exercising, consuming fresh fruits and vegetables, and doing exercise, yoga, and all these measures can help in significantly reducing the risk of cancer for someone. And now for someone who has a risk of cancer, especially people who have a family history of cancer, who had an increased risk of developing cancer compared to normal population, they should be on a regular follow-up with an oncologist. Now that methodology is called as screening for cancer. So these are some of the measures with which one can reduce the risk of cancer.
Thank you, Dr. Subur. Dr. Sunil, if I speak to you, usually if we say healthy lifestyle is always lead a good life. So if we talk about cancer, what we can eat, does eating habit also is the main cause of cancer, and what we can eat to reduce the risk, especially on lifestyle or diet, we can say.
Yeah. So yes, food has a bearing on increasing the risk of cancer. High fatty diet leads to obesity, and high carbohydrate diet also leads to obesity, and obesity is a risk factor for a few cancers. So avoiding junk food and avoiding high fatty diet is a way to prevent few cancers, and also avoiding red meat. So red meat is also a risk factor for colon cancer, breast cancer, and pancreatic cancers, along with others. So avoiding or reducing the intake of red meat is another important factor that such a dietary change has to be made, and avoid using preserved and canned food materials and smoked food. So these preserved and smoked food and stored food products increase the risk of stomach cancers. So these are the few things, and along with that, certain infections which we can develop by consuming an unhygienic food, like the H. pylori bacterial infection in the stomach. This will increase the risk of stomach cancers. So these are the few changes that we need to make, reduce, have a balanced diet. It does not mean there is no single food material that we consume and that reduces the risk significantly. There is nothing like that. We should have a balanced diet rich in fresh fruits and vegetables. There is also no evidence, scientific evidence to say that consuming organic food reduces the risk. But in general, including fresh fruits and vegetables in our diet, we will reduce the risk significantly.
Dr. Shikhar, as this session is for prevention and early detection of the cancer, there must be some screening test. So can you elaborate about some screening test and which is available and which is recommended for the men and women specifically?
So for women, again, as we already discussed, for breast cancer, we have screening mammograms. So all women above the ages of 45 years are recommended to get an annual mammogram up till the age of 54. And up till then, if the mammos have been normal, they can switch to once in 2 years mammograms. For cervical cancers, all women are recommended to undergo pap smear. I think many in our audience must already know about this. Every once in 3 years, pap smears are recommended till the age of 60 to 65 years. After that, it can be stopped. For men, they can undergo a PSA blood test to detect prostate cancer once they have crossed the age of 60 years, which can be done once in every 1 to 2 years, depending on the PSA level and what the oncologist and the patient decide. Colonoscopy used to be recommended once you cross the age of 45 to 50 years, but nowadays it cannot be advised as a routine test. So I would suggest that any person above the age of 45-50 discuss with their oncologist whether or not they should undergo a colonoscopy to detect colon cancer.
Dr. Subur, Dr. Shikhar, we can talk about lung cancer also for heavy smokers, those who have very habit of
Smoking.
consuming.
Those who are heavy smokers,
more frequently,
yes,
large quantities can have a low dose CT for detecting lung cancer.
yes, heavy smokers who have more than 20 to 25 pack year, that means that they have smoked at least a pack of cigarettes for the last 15-20 years, and they are motivated to quit, and they want to know that can they do anything now to pick up lung cancer. As Dr. Sunil sir has rightly said, they can undergo an annual low dose CT scan of the chest to pick up any early signs of lung cancer.
Thank you so much, Dr. Shikhar and Dr. Sunil. I'll come back to you, Dr. Subur. There are two questions that I can ask you combinedly. So we know that cancer is spread genetically. So if someone during the intercourse, it can also spread, right? So can you elaborate?
Let me answer this question by going a bit off the topic. Now, there are certain infections, as we know, that can spread through sexual transmission, such as HIV or hepatitis or even human papilloma virus. Now, these infections can predispose to certain cancers, especially HIV can predispose to lymphomas of cancers. And human papilloma virus can predispose to cervical cancer, penile cancer, or other forms of cancer. Now, cancer per se, a person who has been diagnosed with cancer, they can indulge in routine sexual activity. It is not transmitted through sexual activity, cancer per se, but these infections that can predispose to cancer, they can be transmissible by sexual activity. So that is one thing that I wanted to highlight about this question.
How about genetically, people always are at the risk of cancer if someone has medical history?
Right. Genetics are also very important in knowing the risk factor for risk of particular individual for cancer. And especially, I would like to elaborate about the breast and ovarian cancer. Patients, especially who are a relative, who have a first degree relative, either the parents or their siblings, they are suffering from any of these cancer, breast, ovary, or some other hereditary cancers. They are at a significant risk of development of cancer compared to other individuals. These are a part of something called as genetic syndromes. And one of the common syndromes that we encounter in our clinical practice is the BRCA syndrome, hereditary breast and ovarian cancer syndrome, that can predispose an individual to either breast and ovarian cancers. Apart from breast and ovary, we have certain other genetic syndromes for colorectal cancers as well that can predispose an individual to colorectal cancer, especially Lynch syndrome or FAP syndrome. These are some of the commonly known genetic mutations that can increase the risk of a person to cancer. So that depends on what type of cancer it is and what genetic mutation they are harboring in their body.
Thank you, Dr. Sunil. Dr. Sunil, there's usually there is a risk of recurrence of cancer even after the treatment. So is there any way to prevent recurrence of cancer?
Yeah, all cancers have a risk of recurrence. So what is the magnitude of the risk depends upon the stage at which the patient is diagnosed. and how well he has completed the recommended treatment plan. So to reduce this risk of recurrence, depending upon the stage of the disease, we usually use 2 or more modalities of treatment. So that is how we usually initially attempt to reduce, first treat the disease and as well as reduce the risk of recurrence. So because despite receiving complete recommended treatment plan, there is some magnitude of risk that the patient will likely develop a recurrence. So for that reason, most all patients of cancer are advised to be on regular follow-up after completing their complete treatment plan. Usual recommendations are that they come every 3 monthly for a regular checkup, even though they do not have any clinical signs or symptoms. They should come and consult their oncologist so that a proper examination and evaluation is done, so the recurrence is detected early. But as far as the question is concerned, how to prevent this recurrence, it is to complete the recommended treatment plan within the stipulated time as recommended by the oncologist is the most important one. And along with that, avoid smoking for those who are regular smokers or regular alcohol consumers. They should avoid smoking and quit smoking after their diagnosis at least, so that the recurrence risk reduces. And again, as mentioned earlier, to follow the regular good lifestyle habits, have concentrate on balanced diet, and all these regular measures are anyway need to be followed so that the risk of recurrence is reduced to a significant extent.
Thank you, Dr. Sunil. Dr. Shikhar, I want to talk about, we understand that all cancers are not treated alike. So can you comment on the treatment modalities commonly employed to the cancer treatment?
See, the 3 main pillars of any cancer treatment is surgery, chemotherapy, and radiation therapy. Some combination of these 3 will be used in some sequence to treat the majority of cancer patients. Now, only if the cancer has spread and it is what we call stage 4 disease, that it has spread to a different organ from where it has started, then the role of surgery goes down, and then the patient is treated primarily through chemotherapy. Now, these were the 3 traditional methods, but now with recent developments in understanding the biology of cancers better, we have a new era of treatment coming up that is known as either targeted therapy or immunotherapy. But still, for the majority of patients, surgery, chemotherapy, and radiation therapy is still the backbone of their cancer treatment.
Thank you, Dr. Shikhar. I've already mentioned about ask a question section we have. So we have received some queries regarding the same through our app. So Dr. Subur, you can answer about, there's a person who is asking about how frequently do we need to do PET scans and check the recurrence of the cancer?
Okay. So for someone who has completed their treatment for cancer in their stipulated time, to prevent the risk of recurrence, as Dr. Sunil had mentioned earlier, we need to do certain investigations and clinical examination. One thing I would like to elaborate is not every cancer requires frequent PET scans for monitoring the recurrence. It depends on cancer to cancer again. And then I'll give you a broad view about how to follow up general cancers. So during the first 2 years after completion of treatment, we ask the patient to come for follow-up at a regular frequent intervals of 3 to 4 months. So during the first 2 years after completion of treatment, we are formulating a robust follow-up plan. And then the next 2 years, that is in the 3rd year and 4th year after completion of treatment, we will increase the interval of the 2 scans. So which can be increased to about 6 to 7 months between each scan for the 3rd and 4th year. And then after the 4th year onwards, we can make it annually. So once a year, we can suggest investigations for these patients, and then as and when required, whenever a clinical examination shows some suspicious activity, we can order for a CT scan or a PET scan based on the patient's clinical status.
Till the time we will be receiving some more queries, I'll come back to you, Dr. Sunil. What is the stage of cancer and how important it is to know the stages of cancer?
So yeah, we all know that cancer is usually divided into 4 stages. So what is the stage of the cancer? Stage of cancer means the extent of the disease. It describes the extent of the disease in a given individual. For example, stage 1 means that the disease is confined to the organ of origin. It is just slightly smaller in size, but as the size increases and as the tumor spreads to the surrounding organs or to the distant organs, the stage gradually increases. So usually a stage 4 disease, as Dr. Shekhar has already said, it means that the tumor has spread to an organ which is located a little far away from the site of origin. Like for example, a breast cancer has spread to the bone, or a breast cancer has spread to the liver. So that is a stage 4 cancer. So this stage of the disease has a direct bearing on the treatment options that we choose and also on the outcomes. So as we all know that early stages, stage 1 and stage 2 diseases have a better outcome, and stage 3 and stage 4 have a little poorer outcome. And usually in the early stages, either single or 2 modalities of treatment might be sufficient, but as the stage increases to stage 3, we may have to use 2 or more modalities of treatment. So that is how the stage of the cancer is very important, and it has a direct bearing on treatment and as well as in determining the outcomes of treatment.
Dr. Shekhar, cervical cancer is the most common cancer among women. Are there any vaccines to prevent it?
Yeah, so as Dr. Subur already mentioned, that we know that cervical cancer happens because of the human papilloma virus, the HPV infection. So what many women, they mistakenly think that even after getting married or after having children, they ask us that can we get the HPV vaccine? But unfortunately, it does not work like that. You have to get the HPV vaccine before you are married. So it's recommended that girls between the ages of 9 to 14 years get the HPV vaccine. There are 2 or 3 different companies which sell the different formulations of the vaccine. That is not important. But the age at which one is supposed to get vaccinated is very, very important. It should happen before they are sexually mature. And for that, this age group is recommended. And this vaccine provides nearly 100% efficacy against the future risk of contracting cervical cancer.
Thank you so much, Dr. Shekhar. Let's move back to the Ask a Question session. We have received a query. So, Dr. Sunil, you can answer, what fruits can be given during chemotherapy?
All fruits can be given. There is no restriction as such. I don't think so specifically. Dr. Shekhar or Dr. Subur, do you have any specific
No, we do not have
restriction
any
on
dietary restrictions as such for patients who are on cancer, except when they are diabetic or something where they have to avoid sweets and sugar. Apart from that, we do not have any specific diet for patients who are taking cancer. I would like to mention one thing though. There are certain blood cancers for which we are utilizing aggressive chemotherapy. So during the initial part of the treatment, we advise patients to avoid certain citrus fruits and coconut water and all that, because those patients are at increased risk of developing something called as a tumor lysis syndrome. So to prevent electrolyte abnormalities and all, in certain types of blood cancers only, so we suggest them to avoid citrus fruits and coconut water and all that. But for rest of the cancer treatments, we do not have any dietary restrictions as such.
Okay. Dr. Shekhar, there's one more query. What protein supplement should be given during the treatment of cancer?
As far as possible, I tell my patients not to take any artificial protein powders and all, and just increase the natural protein content of their food. If they eat eggs, then eating 2 to 3 eggs per day is absolutely safe. One can, if they are vegetarians, they can increase the vegetarian protein sources like increasing dal or taking paneer or tofu. Okay, so these are the best natural protein sources that we have. But someone who does not feel like eating, or someone who post chemotherapy or radiation, they have developed ulcers in their mouth and they are unable to chew normal food, only in those patients we advise artificial protein supplements. There are different brands and different formulations. That is not necessarily important. But then only in those cases we advise such artificial supplements. As far as possible, one should stick to the natural protein sources in their diet.
Okay. Dr. Subur, we have a question by the patient. the patient has body pain, what should we give? Must be during the treatment.
All right. So I'll just give a general overview of this particular question. So body pains, again, we need to assess how severe it is, whether it is mild, moderate, or severe. How is the general condition of the patient? So we usually follow something called as the analgesic step ladder given by the World Health Organization. So for mild pains, we usually prefer simple analgesics, simple painkillers like paracetamol or NSAIDs like diclofenac or aceclofenac. For moderate type of pains, we prefer low doses of opioids such as tramadol or tapentadol. For patients who are having severe pain, which is unbearable and or it is not being controlled by the previously mentioned painkillers, then we would prefer very potent opioids such as morphine or fentanyl, be it either infusion form or they can be available as transdermal patches as well. So based on the intensity of pain and the severity and whether the patient is responding to the previous painkillers or not, these are the different varieties of painkillers that we have.
Thank you, Dr.
Can I add, apart from the pharmacological, I mean, these medicines, there are certain interventions also, like the nerve blocks and all. So currently, not that even in advanced cases, advanced cancers, the patient should suffer. We have very advanced pain treatment options currently available. Usually morphine and whatever the step ladder pattern, if we follow, 80% of the pain can be subsided with these medicines itself in those 10 to 20% of the cases where the pain is so severe. Maybe some other interventions like the nerve blocks, etc., can be used to control pain. So that does not mean that patient has to suffer with the pain. They can directly approach their oncologist for proper guidance.
Thank you, Dr. Sunil and Dr. Subur. Dr. Shikhar, I have another question for you. How we can increase the patient appetite? Because usually patient face appetite issue, it can be considered as a side effect of the treatment.
Sorry. So this is a very common side effect of patients who are on chemotherapy, especially. And there are different measures that can be taken to increase appetite, such as changing the flavor of the food by making it more flavorful by adding herbs, etc. The patients can take ginger, which is a natural appetite stimulant, and some sort of physical activity, exercise always helps in improving their fatigue and appetite also. Apart from that, there are certain medicines which we can give. There is a drug known as megestrol acetate, which I have seen in my practice that quite a few patients, they report significantly improved appetite once they have been started on this medicine. So there are measures by which the appetite can be improved. But yes, this is a problem which many patients face, and unfortunately, there is no 100% foolproof way to completely reduce this issue. So diet modifications, lifestyle modifications are necessary.
We are running out of the time. This must be a last question. I'll ask Dr. Subur to you. Hemoglobin, which is usually dropped during the treatment, is there anything that we can add into our diet which can help patient to maintain blood level?
So fall in hemoglobin during chemotherapy can either be because of nutritional deficiencies, the body is not producing enough hemoglobin, or it can be a side effect of the chemotherapy as well. So the dietary modifications that we can do to improve hemoglobin are, we usually prefer ask the patient to consume fresh leafy vegetables. We can ask them to consume jaggery and other hematinics, especially people who can prefer non-vegetarian diet. We can ask them to consume liver or red meat that can improve the hemoglobin. But for vegans, we usually ask them to consume either jaggery or green leafy vegetables that are rich in iron, and they can help in improving hemoglobin. So these are the dietary modifications to increase hemoglobin.
Thank you so much, all three of you, for joining in the session and giving your time to the patients and solve out their queries. And we want to wish you all World Cancer Day as well.
Thank
Thank
you
you
for
again.
having us.
Thank you. Thank you, madam.
Thank you.